Prostate cancer in Black men. Prostate cancer is a critical health issue, particularly for Black men, who are disproportionately affected by the disease. It is one of the most common cancers globally, but its impact varies significantly across populations. In Black men, the incidence and mortality rates of prostate cancer are notably higher than in other racial and ethnic groups. This disparity stems from a complex interplay of genetic, environmental, socioeconomic, and healthcare access factors. Understanding these elements is crucial to addressing the unequal burden and improving outcomes for Black men. Epidemiology of prostate cancer in Black men. Prostate cancer is the second most common cancer among men globally and the leading cause of cancer-related deaths in men. In the United States, Black men have a 70% higher incidence rate and are twice as likely to die from prostate cancer compared to white men. Similar disparities are observed in other parts of the world, particularly where African ancestry populations reside. Early onset and aggressive forms of the disease are more frequently observed in Black men, making early detection and treatment vital. Biological and genetic factors. Research suggests that biological differences may play a significant role in the higher rates of prostate cancer among Black men. Studies indicate that genes involved in androgen metabolism, DNA repair, and cell cycle regulation may contribute to increased susceptibility. For example, variations in the HOXB13 gene, which is involved in prostate development, have been linked to higher risks of developing prostate cancer in men of African descent. Moreover, tumors in Black men tend to be more aggressive, with higher Gleason scores and greater likelihood of spreading beyond the prostate. These genetic predispositions underline the importance of personalized medicine and targeted intervention. Environmental and lifestyle factors. Environmental factors also contribute to the higher burden of prostate cancer among Black men. Diets high in saturated fats, red meats, and low in fruits and vegetables are associated with increased prostate cancer risk. Limited physical activity and obesity, which are more prevalent in some Black communities, exacerbate these risks. Exposure to environmental toxins and disparities in socioeconomic status further compound the issue. Black men are more likely to live in areas with limited access to healthy foods, recreational facilities, and healthcare services, increasing their risk of developing and dying from prostate cancer. Healthcare access and socioeconomic disparities. Access to quality healthcare is a significant determinant of prostate cancer outcomes. Black men often face systemic barriers, including underinsurance, lack of trust in the healthcare system, and fewer opportunities for early screening and timely treatment. Studies have shown that Black men are less likely to receive early-stage diagnoses and are more likely to be diagnosed at advanced stages of the disease. Socioeconomic disparities also play a critical role. Lower income levels, reduced educational opportunities, and systemic racism contribute to delayed diagnosis and suboptimal treatment. These barriers are compounded by implicit biases within the healthcare system, which can result in unequal care delivery. Screening and early detection. Prostate-specific antigen, PSA testing is the most common screening tool for prostate cancer. However, debates around its efficacy and potential overdiagnosis have led to inconsistencies in screening recommendations. For Black men, who are at higher risk, regular PSA testing and digital rectal exams, DRE, are essential for early detection. Healthcare providers and policymakers must advocate for earlier and more frequent screenings for Black men, especially those with a family history of prostate cancer. Community-based initiatives, education campaigns, and culturally tailored interventions can help increase awareness and participation in screening programs. Treatment disparities. Even when prostate cancer is detected, Black men often face disparities in treatment. Studies reveal that Black men are less likely to receive advanced treatments like surgery, radiation, or newer therapeutic options. Instead, they are more likely to receive conservative management or inadequate care. Efforts to address these disparities must focus on improving access to high-quality care, increasing representation of Black men in clinical trials, and ensuring equitable treatment guidelines. Culturally competent care that considers the unique needs and preferences of Black men is essential for improving outcomes. The role of community and education. Community engagement plays a pivotal role in addressing prostate cancer disparities. Grassroots organizations, faith-based groups, and community leaders can help disseminate information about prostate cancer risks, prevention, and treatment. Tailored educational programs can empower Black men to take proactive steps toward their health, including seeking regular checkups and advocating for appropriate care. Increasing awareness about prostate cancer in schools, workplaces, and social networks can also reduce stigma and encourage open discussions about men's health. Collaborative efforts between healthcare providers and communities can build trust and bridge gaps in care. Advancements in research and treatment. Recent advancements in prostate cancer research offer hope for addressing disparities. Genomic studies focusing on men of African descent are shedding light on the unique biological factors driving the disease. Precision medicine approaches, including targeted therapies and immunotherapies, hold promise for improving outcomes in high-risk populations. Clinical trials are critical for developing new treatments, yet Black men remain underrepresented in these studies. Increasing diversity in research is vital to ensure that findings are applicable to all populations and that Black men benefit from the latest innovations. Policy and advocacy. Policymakers have a crucial role in reducing prostate cancer disparities. Investments in public health programs, increased funding for research on health disparities, and policies that promote equitable healthcare access can make a significant impact. Advocacy efforts must focus on eliminating systemic racism in healthcare, ensuring that all individuals have access to preventive care, and addressing social determinants of health. Organizations like the Prostate Cancer Foundation and the American Cancer Society are working to raise awareness, fund research, and provide resources for Black men. Supporting these initiatives and advocating for policy changes can help reduce the burden of prostate cancer. Conclusion. Prostate cancer is a significant health challenge for Black men, driven by a combination of genetic, environmental, socioeconomic, and systemic factors. Addressing this disparity requires a multifaceted approach that includes early detection, equitable treatment, community engagement, and policy changes. By prioritizing research, improving access to care, and empowering communities, we can reduce the burden of prostate cancer and improve outcomes for Black men.